Hi, this is Todd Sora with Action Personal Training, doing our third segment with Dr. Eric Kephart of Kephart Integrative Medicine. Thank you, Dr. Kephart. And today we're entering a subject that I actually, it's a bit out of my wheelhouse, but I'm very interested in it. And I've had one client off the top of my head do it. There could have been more, but so it's a very fascinating subject. It's related to sports injuries or any type of injury, and it is called PRP. And I will ask you directly, Dr. Kephart, what does PRP stand for, and what exactly is it?
Yeah, so platelet-rich plasma is what PRP is, and it's essentially a component of our own blood that we can utilize for healing and tissue regeneration. It's part of a regenerative medicine type of treatment option. Awesome.
And for example, the one client I know of that had it used, she had a shoulder injury. So from my basic understanding, it's usually for ligaments, tendons, that type of thing. But what exactly does it treat, and how is it used?
Yeah, we often see PRP used for treatment of tendons, chronic tendon injuries. We call them tendinopathies, or unhealed old injuries, even ligament sprains, and arthritis, osteoarthritis in joints. We see this used for to help reduce pain and preserve the joint as much as we can.
Oh, that's interesting. I didn't know. Again, some of this is great information for me. I didn't realize arthritis it could be used for.
Yep. So PRP is taken from a blood sample essentially, and so when we have that blood sample, we see that there are three components typically in our blood. We have the plasma layer, and we have a white blood cell and platelet layer, and then a red blood cell layer. So we can separate those layers out through centrifugation, where we spin the blood down at real fast revolutions and can separate those components out. And there are important cytokines and growth factors and peptides within the plasma layer and the white blood cell platelet layer that can improve and aid in healing and even help us preserve some of our cartilage, and that's where it comes into play with degenerative joints.
Oh, that's very cool. Very cool. Are there different types of PRP?
PRP is whole blood, so it's a venous blood that's taken autologous, so that's from the person, and they give a sample of their blood. Now there are various on the market various kits which are used to separate out those components. And that's important sometimes to know what you're going to inject, what you're treating, and so what components do we really want to get. So we can have in the plasma layer, there are proteins that are called A2M and IRAP. Those are important in certain conditions. And then in the white blood cell buffy coat layer, we want to get as much platelets as we can. So we're concentrating that blood down so we have a concentrated platelet sample used to then treat. If we're treating tendons, we'll use a different portions of that of those components, and also in the joints we'd use different components of the blood sample that we draw.
Okay, awesome. Now I assume it's always your own blood, or is there how does that work?
In the case of PRP, it's always just a blood draw that we can do in the office, and then it's actually just spun down in a centrifuge on site at the time you're here, and then re-injected right back into you. So PRP is using what you have at the time that we draw it, and that's another component of all this. That whenever you're thinking about PRP, you want to have a treatment in which we're utilizing ultrasound guidance, because we really want to have the PRP injected exactly where we need it to go, whether it is on the medial femoral condyle for knee arthritis. We want to guide it and direct it there. The MCL ligament, or the common extensor tendon at the elbow. So visualizing the tissue that we're injecting into, or what we gives us the best result.
And how much? Say I come in and make up something. I have a tendon in my shoulder that needs a PRP. How much? What's the process? Do I come in? Is it a small amount of blood? Is it a large amount of blood?
Right. A lot of cases have been, to their family doctor, to their orthopedist. They've tried other things, therapy, etc. Maybe even a cortisone injection, which is a different type of treatment, not necessarily a healing or a regenerating properties in cortisone. It does stop inflammation and take away some pain for a period of time, but it can also damage joints or tissue too. So we have to be careful. But it's just a history and physical exam. We examine where you're injured. We look at your history, look at any imaging that we may have, perform an ultrasound evaluation of the injured part, the shoulder, the knee, the hip, whatever it may be, and then come up with a game plan. If we decide that PRP is what we want to go, we just draw blood there in the office, and we draw 60 mLs of blood for procedure. And that's well tolerated. It's not that much blood. It sounds like a lot, but it doesn't take too much, and it's relatively painless. It's like a blood draw.
Okay.
And then at the time, we just then process it here in the office through the centrifuge, and that takes 15 minutes. We then separate out what we need out of the blood, from the various components and what we're treating. And then we inject it back in with ultrasound there in the same day. So it does take an hour. It's an hour-long type of procedure and office visit.
I was thinking it was longer, so that's great. Wow. I didn't realize it was that quick. And you did bring up cortisone, which was one of my questions I wanted to ask you. I know you just touched on the basics, but in a little more detail. Cortisone is catabolic, right? Does it break down tissue?
Right.
Go ahead. Yeah.
So it's a corticosteroid, and we use it a lot, in trying to reduce pain, especially musculoskeletal pain, as an injection. So it's very good, and it can go in and essentially, decrease inflammation there at the site where it's injected in a relatively quick manner. It can work within hours, a couple days. It really feels a lot better. And then the problem with that is that wherever it's injected, as it is breaking down, or its properties are to stop inflammation, it can also cause some damage to the tissue, whatever it may be that it was in contact with. So repeated injections over time, we know, are not great, although we kind of see that pattern, because cortisone has a half-life and it's gone, and so then its effect of pain relief is also gone. And what do we do then? So that is a difference between PRP and cortisone, and that with PRP we're trying to promote healing through the natural healing response that we get whenever we're injured, to bring in growth factors, cytokines that tell the cells where to go and how they signal each other to regenerate, remodel, and then correct the problem, if you will, as opposed to just kind of covering it up for a period of time, which is what we see more often with cortisone.
Okay. Yeah. That's how I think of cortisone. It can bring temporary relief, but at the same time, the catabolic or the natural breakdown elements of it, temporary and perhaps. Yeah,
I think temporary is a good word, and I think it's effective. It is effective. It definitely does what it says it's going to do. It's just, it's not exactly the right. It doesn't have to be, utilized in every situation. There are these are other alternatives to it.